HIPAA-compliant AI tools for behavioral health should help clinicians work faster. But pick the wrong one, and you buy features that don't fit and new compliance problems. The promise is speed. The risk is paying for buzzwords that don't match how your team actually documents. HIPAA-aligned AI tools for behavioral health. Here is how operators should evaluate them, narrowed to the 2 workflows that matter most. We cover the AI assistant, speech-to-text, the questions every buyer should ask, and what a serious vendor should be able to explain. This guide narrows the field to the 2 workflows that matter most in behavioral health, and they do different jobs. AI assistant tools draft, rewrite, summarize, and answer questions. Speech-to-text tools capture dictated notes in real time. Buyers who understand the difference can build a cleaner rollout plan and avoid paying for features that do not match how their teams work. If a vendor's answers on protected health information are vague, the workflow is not ready for clinical use. And that's the line between a useful tool and a risky one. If the vendor cannot explain directly how protected health information is handled, the post is clear. Move on. Pick a tool that doesn't match how your team documents and you pay for features that don't fit your real workflow. Behave Health's AI assistant is designed to help clinicians get from idea to draft, while its speech-to-text is designed to capture dictated notes in real time. The AI assistant is designed to help when the hard part is getting from idea to draft, progress notes, treatment plan language, and routine communication that still needs human review. Speech-to-text is designed to help when the hard part is typing, fast capture for a team that already knows the structure of the note. Before you compare a single vendor, the guide says to ask a simple set of questions. If the answers are vague, move on. These are the questions that separate a workflow ready for clinical use from one that is not. Let us walk through all 6. Question 1. How is protected health information handled, end to end? A serious vendor should be able to explain how protected health information is protected from capture through storage. Question 2. What role-based permissions are available, so access is controlled by role? Ask what role-based permissions are available and how access to records is controlled by role. Question 3. Can the vendor explain audit logging and record access? A serious vendor should be able to explain how the product handles logs, retention, and deletion of records. Question 4. Is patient data used to train shared models? Ask directly whether the model learns from patient data. If the vendor cannot answer, the workflow is not ready for clinical use. Question 5. How much control do we have over rollout, review, and deletion? Ask how much control you have over rollout, how output is reviewed, and how records are deleted. Question 6. Can the tool fit our documentation workflow without forcing a new one? The best tool fits your existing documentation workflow instead of forcing your team to adopt a new one. A serious behavioral health AI vendor should be able to explain these plainly. These are the details that separate a useful workflow from a risky one. How protected health information is protected end-to-end, and how access is controlled by role. How the product handles logs, retention, and deletion, and whether the model learns from patient data. How clinicians review output before it is saved, and how implementation and training are handled. In practice, many organizations use both tools. One captures the raw note faster. The other helps shape it into something cleaner and more consistent. The combination lets a clinician dictate quickly, then use the AI assistant to polish the note or draft the follow-up communication. Use both if you need a full documentation workflow, capture and refinement working together. Behave Health offers AI tools designed for HIPAA-aligned workflows in behavioral health, built around the 2 jobs the guide describes. The AI assistant is designed to draft, rewrite, summarize, and answer workflow questions, with a human review pass before output is saved. Speech-to-text is designed to capture dictated notes in real time, so clinicians spend less time typing. The AIM is a tool designed to fit your documentation workflow, with control over rollout, review, and deletion. Stop buying AI tools that create new compliance problems. Book a 20-minute demo of the AI assistant and speech-to-text at behavehealth.com. See the AI assistant and speech-to-text designed for HIPAA-aligned behavioral health workflows at behavehealth.com.